Today, I want to ask a simple question. Number one, we are going to talk a bit about infertility. How many of us know somebody who has a problem with infertility? I see. Oh, okay, very good. Now, it is a big problem, and I just wanted to highlight what the issues are, and what the position is, and what can be done about infertility. Now, in 1978, next, I'm not controlling my slides, so it's a bit difficult, so I'll be saying next, so please bear with me. In 1978, three things happened. Number one, I don't know how many of us remember that face. All of us remember that face. The first president of Kenya passed away. That was on 22nd of August. In a short while, we'll be remembering his death. Something else happened in that year. We got the first, or the world, the Catholic Church, elected the first non-Italian to be the Pope. Something momentous as well. Something else happened in that year. 25th of July, 1978, we had the first test tube baby. Test tube in the sense that the baby was not conceived normally. Doctors took an egg and took sperm and fertilized the egg and transferred the embryo into the baby, into the mother's womb, sorry. And last 2 weeks ago, we actually commemorated the 40th anniversary, or the 40th birthday of the first IVF baby. Now, what happened after they got the first IVF baby? People were not happy at all. The first thing they said is that doctors are playing God. He said, look, first of all, her birth made headlines. It was something new. 40 years ago, in the history of medicine, 40 years is not a long stretch. But what IVF has done, it has revolutionized the way people think about infertility. But then, even if it was something positive, a lot of negative things happened. Some people thought that they are going to be Franken babies. Ever watched Frankenstein or something? That movie? So we are going to have children who have horns, maybe, children who have all sorts of deformities and so on and so forth. And there was a huge backlash when the first IVF baby was born. 40 years down the road, because of IVF, we have 6 million, or over 6 million babies who have been born. And by the way, these babies are normal. They are the same normal babies as the ones who have been conceived naturally. Now, what are the problems we have with infertility? We remember when God created Adam and Eve, the first thing he told them is that do what? Multiply and do what? And replenish and fill the earth. And then it becomes a bit paradoxical when God has blessed you, he has given you this man, he has given you this woman, and then all of a sudden you are not able to actually do what? To multiply and replenish and fill the earth. So what are some of the issues? Now, if you look at infertility in the Bible, it is quite prominent actually. We remember Pastor on Saturday, last Sabbath, not this one, but the other one, he had a very powerful sermon about Sarah. Sarah was what? Sarah was barren. And the way he explained in the Bible, he said, it was finished, there was nothing that could have ever been done with that womb. But God is a God of miracles. What did he do? He made Sarah have a baby. Rebecca was barren. Rebecca did not have children. Rachel did not have a child. We remember the story of Rachel and her husband Jacob, until Rachel said, please take my maid so that you can have children with her. And these children will be who? Will be my children. And that is how some of her children were born. We remember Hannah, Samuel's mom, when she went to the temple and prayed until Eli, the priest, said, woman, why do you have to drink early in the morning and come to church? But she was actually pouring out her heart to God. We know the Shunammite woman as well, and so on. So infertility is not a new problem. It is a very old problem, but it affects all of us. So, Solomon says there are some things which are never satisfied. 3 things, and maybe even 4. Number 1, it says the grave, it's never satisfied. People are dying every day. Number 2 is the barren womb. Ladies are trying to get pregnant to have that baby. Number 3, we know fire, which cannot be quelled. And then, of course, the earth, which cannot be satisfied with water, the desert, and so on. I want to introduce infertility, and so that when you meet, or if you have any friends, to know that it is not really it's not an impossible problem. It can be solved. There are 2 types of infertility. The first type is where we have what we call primary infertility, which basically means that if a couple have been together for 1 year, and we have children here. Anyway, they have been together and they are trying to have a baby for 1 year, and they are not using any contraception, and no conception has occurred. That is primary infertility. And secondary infertility means that you have had a pregnancy in the past, or you have had a baby, and you are trying to have another baby, or babies for that matter, and it is not happening, or it hasn't happened. Now, if we look at the developed world, infertility affects about 8 to 9% of the total population. When you come to Kenya, or sub-Saharan, let's go to sub-Saharan Africa first, it is estimated, and these are conservative estimates, that it affects about 30% of the population. When you come to Kenya, it affects about 15% to 20% of the population of Kenya. How does that look in terms of numbers? It's easy to say 15%, 20%, and whatever. Let's assume that the Kenyan population is about 45 million. So a quick calculation, 10% of 45 million is 4.5 million, isn't it? What was Sabu? Now, you add 5% to that. So if 4.5 is 10%, half of that is 2.25. So you put that together, it's about 6.75 million Kenyans have an issue with fertility. So let's bring it a little bit closer to home. It basically means that if we were to take the whole of the population of Nairobi, which is about 4 million plus, so everybody living in Nairobi would actually have an issue with infertility. And then we throw in several counties. We throw in, which county can we throw in, which is highly populated? Sorry? Which one? Kiambu. We throw in Kiambu. We throw in maybe Nakuru. Nakuru Sini County. We throw in Nakuru. So everybody from Nairobi all the way to Nakuru plus Kiambu, and maybe throw in another one, are all have issues with infertility. It's a huge number. That is why the World Health Organization say it is actually the 5th highest serious global disability. A huge problem that we have. Next, please. Now, infertility is a social problem in the sense that those ones who don't have children, if you have friends and you are trying to have a baby and you haven't got there, and your friends have had babies, so what happens? They sort of put you aside. So those baby showers, you are not called the baby showers. When it comes to babies' birthdays, you are not called, and so on and so forth. So you are actually put aside, you are ostracized. It is a medical problem because your body is not functioning the way it is supposed to function. It is a cultural problem. And this, I think, is a much deeper problem. Because number one, we have been culturally socialized to think that if you don't have a baby, then you are actually not a full person, as it were. If you're not called Mama so-and-so, you are not called Baba so-and-so, you are not a human, a complete person, as it were. I meet patients on an everyday basis. And actually, a few weeks ago, I met a couple who came to me. And they said, Daktari, you know, we have 3 children, but we want another one. I said, there's no problem. They got all the children naturally, which is not an issue. But they said, Daktari, the gentleman said, we have 3 daughters, and I need a boy. So again, it goes much deeper. The issue now is not a child, but what type of child that you have. And I think it's a cultural thing. So there we go. And I think something else which we need to actually point out when it comes to the social issues, it doesn't happen in Karengata. I know it doesn't. It happens in other churches. We know couples who have issues with having babies, or who have been married for X years and they haven't had this baby. Na kina mama tunakutana nao, nasema aka katoto na utazaa lini? Utatuita lini tukuje kunywa uji? Na hii tumbo yako kwani na nini? That sort of thing. Not a good thing, I suppose. It doesn't happen in Karengata. That one I'm sure. Sindio? Karengata sisi tuko sawa. It only happens in other churches, in other places there. In Karengata, tuko sawa. So it actually increases a lot of pressure. It puts pressure on these couples, puts pressure on these ladies who are actually going through a very difficult time trying to achieve what God created them for. So please give them time, because it hasn't happened in Karengata. I'm talking to other people out there. Please, please support these couples when they are going through this problem. Yes. Now, some of the possible reasons, some of the possible causes for infertility. First of all, even before I go there, fertility affects all of us. It affects men, it affects women. But culturally, we have been socialized again to think that the problem with infertility affects who? Ladies. Wanaume mbele iko sawa, si ndio? That's what we think. But on the contrary, last week, this is 13th. 2 months ago, a gentleman came to me with his wife, and he's a commando, by the way. He's a commando in one of the armed forces. And he told me, Daktari, I got married and we have an issue. I said, okay, what is the issue? He was married before, and he wanted only one child. And ladies, I always tell gentlemen this. Gentlemen, if the ladies want to have a baby, we are helpless. Completely helpless. They will decide. Sindio, na wanajua, by the way. They will decide. So he came and said, I was married, I divorced my wife. And then I asked her, why did you divorce her? He said, well, I wanted one child. And she knew right from the beginning that I wanted only one child. But then she planned, and she got pregnant. So we ended up having 2 children. And I was very annoyed with her, and because of that, we divorced. I said, oh, really? And then I went a little bit further, because I didn't want it to happen again. I went and had a vasectomy done to make sure that nothing is going to happen. I said, fine. As life is interesting, he has divorced his first wife. He has had a vasectomy. He started a relationship with somebody else. This somebody else also had 2 children, but also divorced. But now they're together. They've been together for 2 years. They've been trying to have a baby, and it hasn't worked. Now he wants to have a baby with this other person, and it wasn't working. So he came and he told me the whole story. I told him, you know what, in your case then, what we need to do is IVF. That is what is going to help you. I said, fine. So they went through the whole process. There was no issue. We reached a stage where we collect eggs from the lady, and it was his turn now to get his seed from him. So we sent him to the lab to get his seed. There was nothing, because he had done a vasectomy. He tried again, and there was nothing. So I had to take him to theater to try and get his seed from the testicles. And there was nothing as well. So after we finished, I sat him down and told him, you know what, unfortunately, we couldn't get anything. And then he was shocked. And then he asked me, what alternative do we have? I said, well, the alternative is to use somebody else's seed. what you call donor sperm. I can hear questions. I can see gentlemen are shaking their heads. Anyway, so what he did, he said, okay, this is the one I want. I said, fine. And then he asked me something. He told me, please, Daktari, I beg you. He was literally kneeling. He said, please, 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 don't tell my wife. Please, I beg you, please, never ever, let her just think it is the process. Then I said, but you see, I can't do that. We need a consent from her as well. He said, please do anything, but not let her know. Well, we left it at that. We had to organize and do something different. So here we are. These are some of the paradoxes that we have. Another case which I have, before we go to the reasons, 40 minutes is not enough, by the way, but we will see what justice can do. When it comes to age, ladies' age is a big, big issue. We want to suggest that ladies, when you get to 35, or get the children before 35, because after 35, the chances of getting pregnant actually do decrease. But that doesn't stop ladies who are older from getting children. A couple came to me sometime last year. She was 45, and the gentleman was 47. So after I walked through the history and talked with them, I told them, you know what, it is not possible for you to use your eggs to have a baby, but you can use somebody else. So the gentleman was saying, hey, to me, I'm begging you to mwingine, but here now is opposite. So the couple was okay. They said, fine, there's no problem. And we started the process. We got a young lady who was actually happy to donate her eggs, and we went through the whole process. But before we reached there, I had asked the gentleman to come and give his sample so that we know what the problem is. He never came. So the wife calls me and tells me, Daktari, please, can you talk to my husband so that he can come and do what he has to do? I tried to talk to him. He promised he was going to come. He never came. We are nearing the day of our collection. I called the lady again and said, please ask your husband to come. We need to know what we are going to deal with. He said, Daktari, I have been fighting. It is a fight with this man. Every time I discuss with him, he goes to the other room and hides there and keeps quiet. There was a clip somewhere I think in WhatsApp, how men's brains and how women's brains work. We remember watching that clip? So this man would go into his nothing box and stay there. And ladies can never understand when they see gentlemen seated, when they ask us, what are you doing? You say, you are doing nothing. Ladies can't do nothing. There are things going on in their brains all the time. But men, we are comfortable. Tutaka, and we'll be doing nothing. And we are happy. So this gentleman would go into his nothing box and sit there, and the lady would not actually communicate with him at all. She tried to beg him, he refused. The man ran away from home and went up country to his parents' place. So the lady followed him actually up country. And she went and talked to the parents-in-law. Mambia, we are having an issue. This young man has run away. And there's something he's supposed to be doing, and he hasn't done it. The father tried to talk to him. He refused to listen to what the father was saying. So the lady's in a dilemma. So we get to egg collection. I have collected the eggs, and I'm waiting for the sample. Sample is not there. So I call the lady and I tell her, you know what? We have collected the eggs. We have 3 hours, and we can do one or two things. We can either freeze the eggs, and then we use them later on after you have had a discussion with your hubby and you've come to a conclusion, or you can decide and do something different. And she told me, Daktari, give me 2 hours, give me an hour. So later on, I called her back and she said, you know, Daktari, I have tried talking to this man. He has refused. Give me 1 hour, I'll be at the clinic. So she comes after an hour. She tells me, she tells my nurse, show me the donors that you have. And my nurse is a bit shocked because she knows she's married. So she shows her the donors that are there. And she looks at them because we have passport-sized pictures, and she says, this one. He says, okay, this one is one of you. This is one you decided. He said, yes, okay. Give me the consent forms. She's a grown-up, Cindy. She was given the consent forms, and she signed. She says, those eggs to me are he. And Ikatumika, we got embryos, what you call blastocysts when they go to day 5. I did a transfer on her, and she became pregnant. Carried twins. So she came for antenatal care, and the first, you know, I'm a bit intrigued. What is going on in her mind? What is going on in the family? So the first visit, there was no problem. We talked. The second one, the third one. So I asked her, is everything okay at home? She says, yes, everything is fine. So I want to find out how the husband is responding to the situation. But she wasn't getting the hint. So until I asked her, so what does your husband think about, you know, the whole thing? And she says, you know, Daktari, families are different. And I actually left it that way. Families are different. She delivered, I think about 6 weeks ago. She has a baby boy and a baby girl. Cindy. So this lady, when the husband, I can imagine, when the husband wants to discipline the children, she will say, well, wacha watoto wangu. Usiguze watoto wangu. But you see, these are the dilemmas that we have. So what are some of the reasons, what are some of the causes of infertility? In men, we have issues with chronic diseases, diabetes, hypertension. We have issues with blocked tubes. We have issues with trauma, surgery. We have issues sometimes when the testicles are not descended. We have issues with infectious diseases. For example, there is what we call mumps, which is okay, and actually all boys should have mumps. But when the gentleman, when you are old, when you're mature, when you have mumps, unfortunately it burns everything and so on. We have issues with genetic diseases, but fortunately this is not in this part of the world. It affects more Jews, especially Ashkenazi Jews, because they intermarry amongst themselves very much, and they keep on, you know, passing on these problems to their children. Next, please. We have issues as we grow older. If you have high blood pressure, you have diabetes. We have erectile dysfunction. We have issues sometimes with the sample not coming out the way it's supposed to come out. There can be a problem with the connections in the tubes and the pipes, as it were, and the sample goes backwards. And there was a time, I think a year ago, 2 years ago, when there was a problem in central Kenya, and the ladies there walikuwa nangoa transformer. But I think that is a Kenyan problem. We don't find it elsewhere. So there are a lot of issues which can affect men. Next, please. With ladies, age is a big problem. And it is actually becoming a bigger problem now in this part of the world. But the higher percentage of ladies I see with infertility have issues with blocked tubes. And blocked tubes, most of the time, is because of infectious diseases. Infectious diseases like sexually transmitted diseases. Chlamydia is a big issue because chlamydia actually doesn't show any symptoms at all. There have been issues in the past with gonorrhea, with syphilis, and so on and so on. We have a lot of ladies who have issues with what we call polycystic ovaries. And with polycystic ovaries, these ladies try to get pregnant. They have issues with their cycles, which are extremely irregular. They have issues with their metabolism of sugar, and so on and so forth. We have problems with fibroids. One of my colleagues, I think it's Dr. Buckley, will talk about fibroids later on. 40 to 60% of ladies of African descent, in your reproductive period, you will have fibroids. The issue is not fibroids per se. It's not even the size per se, but the location is extremely important. If we have fibroids which are touching in the cavity, and that is where the baby normally implants and grows, it will have an impact on fertility. If we have complications post-surgery, say, for example, you went to have your appendix removed, and then afterwards there were issues, that can lead to tubal blockage and many other problems. Abortion is a very big problem in this country, even though legally abortion is not allowed. It's only allowed in a very tiny fraction of cases, but we know that almost 450,000 abortions are done in this country illegally. And if they are done illegally, it means that there are going to be complications, because the people who are doing them are not qualified, they don't have medical, don't have medical knowledge, and a lot of infections occur, which lead to complications. Sometimes you may have ladies who are born without wombs. So you have a lady who is mature, and she's 20, 27, even more years, and she's never had a period at all because she was born without a womb. Okay, so that can also be an issue. Next, please. Endometriosis is also another problem, whereby a bit of the lining, which normally comes out during the period, is embedded elsewhere in the body. It can be embedded, on the tube, on the ovary, or even on any other organ in the body, and that actually is a problem and can lead to infertility. When it comes to medical conditions, I mentioned diabetes, hypertension, lifestyle, alcohol drinking, what we eat. 2 years ago, there's a lady who came to see me, and as I was taking the history, one of the things I asked is, do you smoke or do you drink? And obviously she said no, she doesn't smoke, but yes, she drinks. So when I ask, what do you drink? Because people drink all sorts of things. Most ladies will say a glass of wine, a glass of this, a bottle of beer, and so on. So she says, a bottle. So I ask, a bottle of what? She says, a bottle of, I said, a bottle of wine? She said, no, it's not a bottle of wine. He says, so a bottle of what? He said, a bottle of Johnny Walker, 1 liter. So I asked her, 1 liter? I said, yes. In what period? Well, you can say a bottle, maybe a week, maybe 2 weeks, or whatever it is. She says, every Saturday night, I drink 1 bottle of Johnny Walker. That is a liter of Johnny Walker. So I can imagine how her liver is feeling and how she normally behaves. So it's a huge amount of alcohol. But again, ladies, unfortunately, these days are behaving just like men, or even worse, especially the ladies in the corporate world. I hear when it comes to drinking, they drink even worse than the gentlemen. And later on, these are the ladies who have issues. They come back, say, we are having issues in trying to get pregnant. They're having issues in relationships. They're having issues, etc., etc. But I think that is what Paul says, in the last days, there will be interesting things, and we are seeing them now. Sometimes it's a combination of factors. You may have chronic diseases, you may have endometriosis, age is a factor, and you have to deal with all these together. Next, please. Now, what are some of the consequences of infertility? There is stigma that I don't have a child, or we don't have a child. And then there's something else. Actually, this stigma is twofold. We don't have a child, and then when you have this child through IVF, people are saying, you know what, you didn't have this child in the proper way. So society is unfair either way. I was supposed to talk on one of the programs the other day, and the presenter asked me whether I could get any of the patients who had successfully gone through an IVF treatment and had had children. So I talked with one of my patients who had successfully delivered triplets, 2 boys and a girl, and she was very enthusiastic about it, and she wanted to come to the show, but the husband said, you know what, Daktari, no, we will not do it because of the children. Then I asked why, because of the children. He said, you know, if we go out there, we don't, even some of our friends actually don't know we got these children through IVF, and we don't want them to know. So we want it to be our own little secret, as it were. So if we were to come out on national TV or whatever it is and start, you know, talking about this, later on, it's going to may affect actually these children. Say, oh, well, is Ali an IVF? So you are not a normal baby, sort of. So there is that stigma of not having a baby, so you are not a complete person. And there is the stigma now afterwards, said you got these children not in the way you're supposed to get them. There's another lady also who also successfully had triplets, and we had met somewhere and I did the transfer. And she asked me at one time, she begged me, she told me, Daktari, please, if we ever meet our common friends, never ever tell them where we met, that we met in an IVF clinic. Never ever tell them. I said, but why? He said, because I don't want them to know. Because later on, they are going to think that I did not have these children in the right way. So there is that stigma. The stigma of not having children, the stigma of having these children through other methods. Now, there is a social isolation and feeling, you know, rejected. I mentioned that in the beginning, that when you have these children and you are trying to have a children, your friends sort of isolate you, and you are different. They start, you know, when they start talking about children's stories, how the children are puking and keeping them awake at night and so on, you are left out. There is low self-esteem, that feeling of I'm not complete without a baby, without a child. I'm not Mama so-and-so, I'm not Baba so-and-so. And then even your own mothers-in-law say now, I need to have grandchildren. When are these grandchildren coming? So there is that social pressure and feeling incomplete. There is psychological stress. Denial comes in, depression comes in, and so on. There is violence as well. I don't know whether we remember about that lady who had her hands chopped off by the husband. And then it turned out that the husband is the one who had an issue, and it was not the lady. But there it is. So there is violence as well. The violence may not only be physical, but it can also be psychological. One of the ladies, there's a lady who sent me a message. He said, you know, I was so shocked that my husband has saved my number under a title, not my name, but barren. So my husband has saved my number under barren. And she noticed that one time, and she said, Allah, it's my number, but then the name that is used is not my name. So you can imagine how much stress that lady is going through. We know that families break down, relationships break down because of not having children. So the parents come and tell you, especially in-laws, they tell you, if you can't have a child, do what? So you leta mwanamke mwingine. Leta mwanamke mwingine. And this actually is not in the so-called bottom of the pyramid families. It happens everywhere. A very, very prominent family in this country, the son could not have children normally. So after 1 year of marriage, the mother called him and said, I want grandchildren. If this woman can't give me grandchildren, chase her away, let her mwingine. So what the gentleman did, luckily they are well endowed, so they took a shopping trip to South Africa. They went and had IVF done there. Luckily, the first time it was done, the lady got pregnant. She came back, she delivered a baby boy. So the mother-in-law was very happy. After 1.5 years, she called the boy again, the gentleman, said, I can't have only one. Nataka mtoto mwingine. So the young man knew what the problem was. So they took another shopping trip to South Africa. And they went and did what is called a frozen embryo transfer. And luckily, she conceived again, she came back, delivered a baby girl. So the mother-in-law is happy. I have a baby boy and a baby girl. But what this couple said is that we will never, never tell our mother that actually these children, her grandchildren, were conceived through IVF. Stigma again, okay? And then that pressure. And then there's polygamy. If you can't have a baby, so your husband can actually marry, other women. But then, surprisingly, if it is the men who have the issue, the ladies, can you get other men as well? Can you get other men? Polyandry. It is not acceptable socially, but there it is. But for the men, if she can't have a baby, let her mwingine. I met a gentleman came to see me from Somali community, and he said, Daktari, I've tried getting a baby, but something is not right. I said, what is the problem? He says, every time I get married, I stay with this lady for 2 years, 3 years, they don't have a child, I don't have a child, and she goes away. And I have been married 4 times. The first wife, we have a baby together, who was basically a grown-up, 19 years old. And then from that time, I've been trying to have another baby, and I'm not having any. So every time we don't have a baby, I do what? I chase and bring another one. I chase and bring another one. 5 times. What is the problem? I said, I don't know what the problem may be, but why don't you have a test done? So he had a test done, and it was negative. Hakuwa na chochote. So he came with the result and said, I did this test elsewhere, and it shows me that I don't have anything. He said, well, that is what the test says, but why don't we do it again, just to confirm? So he went and did it in another place. He brought the results back, and I look at them and I tell them, you know what, the result is exactly the same as the first one. And the guy was shocked. And then he looks at me, and then he asked me, Daktari, let me ask you a question. If all these 4 women have chased away because we didn't have a baby, whose is that child? First one. So I told him, I can't answer that question because I don't know. So you see, there are issues of polygamy. So you don't have a child, nenda, we'll get another wife, and so on. So there are problems with that. Now, some of the consequences that in some societies you don't have a child, you don't have children. We are an agrarian society, so we don't have children to go and work on the farm and so on, bring an income, so you are actually a burden to us. And families don't want burdens. So, fukuza uyo leta mwingine, okay? We remember Dr. Daya, was it Dr. Daya or Bishop Daya or Bishop Dr. Daya? Maybe to give you, to do it. Sorry, Pastor. All of the above. Pastor, Bishop, Dr. Daya. Okay, fine. We remember the miracle babies, okay? So you take a child from wherever it is and you actually traffic, which is child trafficking. And what they were trying to do is to satisfy that need of couples who did not have children, who don't have children, and it landed them in trouble. And every so often we read in newspapers about somebody who has lost his child because somebody else came and stole it. Now, in the Ma community, the Maasai, if I can't have a child, by the way, how much time do we have? We don't have a timekeeper. Because I can continue talking and into If I can't have a baby, can't have a child, What happens is 10 minutes. Okay. What happens is that my colleagues, my age mates, can actually come and help me. So I discreetly disappear. Somebody comes and helps me, and that baby is our baby. So we can imagine the number of issues which come because of this. There are issues with sexually transmitted diseases, AIDS is a problem, and so on and so forth. So promiscuity, but it's allowed in the Maasai culture. In other places, ladies who never had children could actually marry a young lady, and they allowed this young lady to go out there and have children, and these children will belong to this lady who never had children. And then there are issues with inheritance as well, and it becomes a huge problem, especially in our country, where if you have some property and you don't have children, it becomes a problem. So children not having them is an issue, and when you have them through other means, sometimes it can also be a problem. Next, please. So in order for us to increase the chances of having a baby, number one, we are what we eat. And it is literally that way. God gave us greens, God gave us nuts, God gave us water, God gave us all these things, but we have decided to eat. I know we love nyama choma. People love nyama. Adventists don't, but other people love them. Sindio? Sisi ni watu wa health message, sindio? Yeah. So some of the foods that we eat actually are a hindrance to having children. We do less exercise these days. If I'm moving from point A to point B, why should I walk and I have 3 cars in the garage? Sindio? In any case, I've worked so hard to get where they are. See what is it to me? So what happens afterwards? So we add on weight, and this weight actually has issues. Now, with exercise is something else. Number 1, you get more oxygen into your system. Number 2, you feel better. Number 3, you lose that weight. Number 4, you will perform better. I don't want to say where. Now, for the people who use alcohol, maybe reducing that alcohol, it doesn't affect Adventists. It affects other people out there. They may have to reduce the intake of alcohol. Some medications can actually affect, oh, that's not my bell. Some of the medications that we take can actually affect our performance. Gentlemen who work with laptops. Na tunazieka wapi? But that is why they are called laptops, isn't it? On top of the lap. Now, the crown jewels don't like heat. The crown jewels don't like it. I'm calling them crown jewels so that we know exactly what you're doing. Because the heat that is generated by the laptop as it's working can actually affect production, can affect storage and performance later on. So please, if you have to use a laptop, avoid putting it on your lap. That is for gentlemen. For the ladies, starting to use folic acid, for example, right at the beginning, eating healthily and so on can also help. Stress is also a big problem. But now the question of how much stress can actually affect, getting pregnant. It's very difficult to quantify that X amount of stress is actually can actually affect my getting pregnant. Why are we saying this? Because we see ladies who are trying to have a baby, and then we take the same age group, ladies who have a child and are trying to have another baby, the chances of this other group having a child is much higher than in the case whereby, in the group whereby these ladies don't have any child. This is because if I have a child, if I have an additional one, that is fine. Mungu atakuwa amenibariki mara mbili. But these ones who don't have, it is, I must have this baby. It's a life and death situation. So their stress is much more than these other ladies' stress. But stress can be a factor. So if you are going to diagnose infertility, there are things that we look at, and medical history is important. For the gentlemen, you need to give us a sample, we have a look at it. And for the ladies, we need to check, number one, whether the tubes are okay. We may need to do a scan. We may also need to do some blood tests to look at the hormone levels. Yes, next please. And treatment, there are different ways of treating. There's medical, where you use some tablets to increase the ovulation, if I can use that term. And there are all sorts of treatment medications that we use. We can also do, next please. There is surgical, where we remove the problem. Chances, if there's a gentleman who had vasectomy, reversal of vasectomy doesn't help a lot, but there are some people who think it does. Treatment of any other issues, if there are swollen vessels in the scrotum, if there's undescended or twisted testicles, and so on and so forth. We can also actually retrieve a sample from the testicle itself. In surgery, when it comes to surgery, we can remove the fibroids which are there. If there are any issues with endometriosis, we can treat them. If there are any adhesions, we can also remove them. We can actually even preserve the eggs that we get prior to any chemotherapy or radiotherapy. Next, please. Now, when it comes to treatment now, this is the higher end of treating infertility. We have what we call IUI, where you can inseminate, call it inseminate, artificial insemination. There is IVF, that is where we get the eggs, we get the sperm, and fertilize the egg. And once the embryo is ready, we can actually transfer the embryo into the womb. There is ICSI, where we actually get the egg and insert the sperm into the egg. We inject it directly into the egg. There is egg donation. There is sperm donation as well. There is even embryo donation. If a couple have an embryo, have extra embryos, they don't intend to use them, they can actually share them with other couples who may be having issues. Freezing of eggs, freezing of sperm, we can actually freeze them for 5, even up to 10 years. The record, I think it was sometime last year, a baby who was born after the embryos had been frozen for 20 years. So it is possible. So if you have one born after 20 years and one who was born 20 years before, so are they elder brother and elder sister, or are they the same age? These are issues we don't know. Now, there are some other things which is a little bit more interesting we can go into. You remember the story I told you about a gentleman, a couple who came and they said they wanted a boy and they had 3 girls? Well, we can actually do what is called sex determination and choose embryo number 1, embryo number 5, embryo number 10. Hawa ni wanaume. Embryo number 3, number 2, number 6, hawa ni wasichana. So you can actually choose. Morally, ethically, we are not going to discuss that here. But there is that option. There is that option. In some countries, it's actually banned. In the UK, for example, you can't do sex selection. In India, you can't do sex selection. But America is free for all. You can do anything you want. Kenya, we are somewhere in between. Now, there's something else which has actually come out of this treatment, which is very interesting, because we know that some families have some hereditary diseases. For example, hemophilia, where you have bleeding, where we have sickle cell anemia, for example, which is actually a trait which we find in this part of the world, which is protective in a way against malaria, but then in the long run, it actually affects our bodies. So we can actually check and see which embryo has hemophilia, which embryo has sickle cell disease, which embryo has whatever disease, and then not transfer those ones. So we transfer the healthy embryos only. People are going to ask, is it possible also to choose the color of the eyes and the height and so on and so forth? It is actually possible, but we will not go there. All of us have black eyes, and so for Kenyans, it's not a problem. For Europeans, it can actually be an issue. So these are some of the things that we can do. God has given us the knowledge. God has given us the ability. But we want to use this knowledge and this ability to His glory. We want to help people who have issues with having babies, and we want to glorify God. I want to thank you for listening to me. And if you have, is there any one or two questions from the crowd which we can answer quickly? Sister Lois has a question.
Thank you so very much. It's very enlightening. Just wanted to, if you can give us the costings, so the cost of this treatment, so that we can advise some more.
Now, when it comes to costs, it's a little bit on the higher side in this part of the world. To go through an IVF cycle costs about 400,000. If we are going to freeze your embryos, we freeze them for 30,000 for 1 year, for the first year. Afterwards, it's 15,000. Something interesting is that NHIF is actually paying for treatment, for IVF treatment, for civil servants. For civil servants. So if you know somebody who works in the ministry of whichever ministry, they can actually have this treatment through the NHIF. I think it's a bit discriminatory. All of us pay NHIFs, isn't it? So I think I need to talk to Elder Kunga here. We go to court and talk to and file a case against NHIF. Watch a discrimination, because the Constitution clearly says we cannot be discriminated based on age, sex, or whatever else. So, yeah.